Sanbanani babugeli emakhaya, welcome kini nonke kulo uhlelo lethu esilithanda kakhulu i-holistic healthy living with uzinhle wakamazibuko. Siyabonga kakhulu ukuthi nibe kanye nathi namhlanje, where we teach you everything about health. Kanti ke siyakhumbula ukuthi siye savala Women's Month with a wonderful show with the coach. We were exercising, it was heated, begumnandi, and today we bring you more of izinto ezizosiza wena to know better and more about the health so that you can take better responsibility Mayelana with your health. So today we have none other than our representatives from Mofokeng. We have Kanti Mr. David Libete, Ganye Naye Usisi Ignatia Nzima. Yes, and so they will definitely be telling us more about themselves, who they are, what they do, and trust me, you do not want to miss this one. We will be talking about important things that you need to do if uhlangabezana na some emergency situation while umele ama-paramedic wenza njani senzani umuntu wenzakala lokhu. Remember, holistic healthy living wants you to know better about your health so that you can teach what you know to other people and that you can take better responsibility of your health. Kanti we won't even waste time. Sanibonani, sanibonani, ninjani. Mr. David.
Thank you, Zindla, for having us here, and thank you.
Wow, so please tell us about yourself. Ubani, wagupi, wenzani. We are seeing you in bona orange, blue, gunzima, uhlonpegile. Like you look, highly esteemed. Really, we take paramedics, of high esteem. So please tell us, who are you and what do you do?
Thank you again for the compliment. My name is David Libete. I'm the general manager from Mofokeng. Professionally, I'm an advanced life support paramedic.
Okay.
In November, I'll be turning 30 years in the industry.
Wow, 30 years.
30, yes, yeah. That includes a local and international experience as well.
International experience?
Yes.
So, Jay, okay, before we get there, what is a paramedic? Can you just tell us, what is a paramedic?
Good question. A paramedic is somebody who's trained by an accredited facility and is registered with a health professional council.
Oh, okay.
A paramedic, we've got 3 levels. We've got the basic, we've got intermediate, and we've got advanced life support. Okay, those are the levels. So their practice or their capabilities are significantly different. Yes.
Kanti ngiyabona ukuthi awuhambi uwedwa. Miss Nzima, sawubona.
Yebo mama.
Ninjani?
Siyaphila sisi.
Wow, siyabonga ukuthi nize nihlanganyele kanye nathi. Please tell us, what do you do?
Mina ngu-Ignatia Nzima ne. Ngiyi-BLS control.
Okay.
Usebenza e-control room as a BLS control.
Okay. Yes. Now I just need to ask you, why did you choose to go into EMS?
I-EMS yinto benginothando lwayo mangisakhula. Mangikhula ekhaya ugogwami bekanesifo senhliziyo.
Yeah.
So ngelinye ilanga bengifisa ukuthi ngathi ngamnceda kodwa ngingazi ukuthi ngamnceda kanjani. Until ngaba nothando lokuthi ngiqhubekele kule industry. Then manje sengiyakhona ukuthi ngibasize abanye abantu ngaleyo ndlela.
Wow, that is quite inspiring. And quickly, if one wants to know, how can I become a paramedic? I love this. I want to do it. Can someone just tell us, how can one actually do it? What are the first few steps?
Very, very, very critical questions, Indle. What I always encourage people that wish to get in the industry is make sure you know everything that you need to know of being a paramedic. Because we find people that actually knew little about being a paramedic. They spending time, they spending money, and they realize that's actually not for them. So for somebody who's aspiring or wishing to be in this industry, they need to go to fire stations, ambulance services, spend some quality time there where they can be introduced into the profession itself, and then they can make an informed decision. I think that is the starting point.
Okay. So anyone can go there, like, just for some experience, anyone can go there to find, more information?
everybody's
Or is there
welcome
a
there.
procedure or something maybe you need to have or have done, or can you just go ambulance services and you just want to spend time there and just see what's what?
Okay, to be able to practice or to participate in activities there,
Yeah.
you have to be 21 years and
Alright.
above. So age is
Yeah.
critical, and you need to sign an indemnity with the assisting provider, and they will explain to you the procedure or the process there, because it might differ from provincial to private.
I love that. Babukeli emakhaya nizizwele, if you want to go into this field, uthi-ke uBabu David, don't just go in it blindly. Marakala, go and find out information. Be sure that this is indeed what you want to do. Before you spend money, before you enroll here or there, first go and find out all the information that you need before you can actually get into this field. So singamoshanga ke isikhathi sizongena endabeni zanamhlanje. Now, we want to know about a few things. All right. Ukuthi, if uwehlagelelwa yile simo or someone around you actually experiences this, what can one do? Something very common happening everywhere really is choking. So, before we get into that, can you just maybe tell us, ukuthi, what is choking?
Okay. Choking in basic terms
Yeah.
is there is an obstruction of the airway.
Okay.
So a foreign body or a foreign material is blocking the airway. So air cannot go right through to your lungs
Correct.
from the mouth or the nostrils.
Okay.
In basic terms, that is choking.
Love it. Ngiyacabanga nje ukuthi it was very crystal clear. Sonke ababukeli emakhaya, we understand exactly what it is. Now, what are the signs or the symptoms that one is actually choking?
Okay. The common signs of choking, or the symptoms as well, is we've got what we call a universal choking sign.
Alright.
Okay. Commonly, the people or somebody who's choking, they will hold themselves like this. It is very common, yes, yeah.
Okay.
And it's called a universal choking sign. But that doesn't necessarily mean everybody will present like that. So if somebody is not holding like this, no, it's not choking. Not in, absolutely not. Okay, so that is a common sign for choking. Somebody who's choking, they might cough.
Okay.
You know, a sudden dry cough, unexplained. Coughing is it, and they will tell you that they're struggling to breathe. And you will see restlessness as well. If it's an adult, as I'm saying, they will tell you that they are struggling to breathe.
Yeah.
But now, if it's an infant who cannot talk, obviously, you will have to rely on other signs.
Okay. And
Okay.
what are these other signs, please?
That is restlessness, which is very, very common, and I hope it doesn't get to a point where they change the color. Okay, but restlessness, they're trying to cry, there is no sound coming, and the activity, what they were doing prior to the incident, like maybe they were eating or they were playing with an object, a marble, and a marble is missing there. So you need to be led by the clues there.
Okay. And now quickly getting into that, what are the common things that people choke on, especially in kids,
Okay.
especially in, the young ones? What are the common things that they may choke on?
Okay, most of the toys are written on the packs
Yeah.
to say for this age and up, for this and is for the reason.
Okay.
Okay, so we need to supervise or make efforts of supervising kids so they don't play with small object that they can swallow. So what I'm saying now is kids normally choke on toys.
Yes.
Yeah, small toys. That is very common. And then the second one might be food. If kids are eating unsupervised, they might be playing, they might be talking, screaming, singing while they're eating. That can actually lead to choking.
Okay.
Okay.
And now, which would bring, me to the next question. Ukuthi kanti kahle kahle, well, we don't really have to go into the pathophysiology, but rather, how does one actually end up choking? Maybe it's a concept that, is not so clear. Can you just briefly take us through how does actually choking come about?
Okay, and I will make a scenario, and I'm hoping that it will answer or clarify how choking happens. So this individual is eating
Yes.
and talking, and maybe a little bit of intoxication there as well.
All right.
And so you're not concentrating on the process of eating.
Okay.
Okay, then part of the food can go down the throat, okay, or the airway, and then will cause, maybe if you're lucky, it will be partial blockage, or it can be complete occlusion, which is a dire emergency. Okay, so
All right. And is that where you guys would come in?
indeed.
Okay, and we will get into that kancane, and you will be demonstrating to us ukuthi, so now here comes someone, they're choking,
Right.
what exactly to do.
Yes.
All right, and you'll talk us through that
Correct.
as we go. Okay, babukeli amakhaya, I hope ukuthi nilalele and niyezwa. And I think it's very important that we emphasize, you know, a lot as we grow up, we're probably taught, you know, don't eat and talk. And usually, you know, it's just about mannerisms, you know,
True.
you know, good manners. But actually, there's also a life-saving aspect to it, because as you said, you know, you can't really be eating and talking, because then the food would go down the wrong pipe. And now, how common is choking? How common is it?
Okay. Choking is fairly common, so it happens. We cannot say no, it doesn't happen, or it's fairly common. So it happens. And if you ask me as in whether it's common in kids or adults, I think it's common both areas.
Really?
Yes.
So in adults as much as
It does happen,
kids?
yes.
Oh, wow, that is quite interesting. And okay, and then something like what is the worst end outcome of choking?
Okay. Sadly, if there is no intervention or nothing happens, the patient or the individual can lose life.
Wow.
That's how serious it is. Okay. So intervention is very critical and it's very urgent.
Okay.
What normally happens,
Yes.
should one or a family experience that situation,
Yeah.
when you call for an ambulance or when you call for professional help,
Yeah.
you need to listen very careful to what they say, because that is very much life-saving.
All right.
Okay. They will guide you what to do while you're still waiting for professional help, isn't it? Okay. So sometimes people are saying it's not easy to be calm while you're having a situation.
Definitely.
Okay. But we are encouraging and emphasizing to viewers to say, do your utmost best to be calm, so that the person who's receiving you or the person who's attempting to help you that side can hear you clearly and can give you instructions and guidance accordingly. Okay, so that is the starting point of how you can manage successfully a choking incident.
Okay, and then one more question before we move on to the next one is, nakoge umuntu has been choking. After how long could it be detrimental? Like after how long, if like you're really not winning with the interventions, yes, ni phone the ambulance, but you're still waiting, you were trying, you're not calm, things are not working out. After how long would you say the isn't to say zimbi, like, you know what, even the outcome is not so
Okay,
great?
okay. And it's a very interesting and valid question. The time becomes a problem
Yep.
for specifically one reason. How I behave when I'm choking
Yes.
versus you behaving when you are choking. If you are having underlying medical problems, for an example, you know, you will struggle to survive, you know, in comparison to somebody who was healthy. But the important fact here is when you're not having oxygen, it's critical. It's very urgent. Losing life is not going to take too long. So, but to put time on the table to say after 5 minutes, 10 minutes, it would be difficult. It differs from human to...
Depends, okay, from
Absolutely.
individual to individual.
Absolutely.
All right, I love that. Now, as we mentioned earlier, they will definitely be taking us through what's it. Nakoage, one is choking. What do you do? Now let us move on to the next very common thing, which actually scares a lot of people. I must say, when it happens, you know, it's either people run away or mara, basically it causes a general panic. And that is when someone is having an epileptic fit.
Okay.
Everyone goes crazy. Everyone is scared. Omunye wenza logo, omunye wenza logana. Lots of mixed instructions.
Right.
You don't really know what to do. Quickly, please tell us what is an epileptic fit. Or
Okay.
what is epilepsy?
Okay. In basic terms again, and I
Yes,
will try to
please.
put it very basic.
terms.
Yes, yeah.
Basic terms so that
Okay.
Tina sizwisisane lapha emakhaya, because kakhulu people will be like, yeah, but no, you guys in the health professional, there's a lot of jargon. Asinizi ukuthi nithini.
Right.
Nishaya ngabo medulla oblongata. So asifuni logo, instead sifuna ukuthi uzwe ukhona, when you understand something, it's you can retain that information, yabo, because we understand. But if you don't really understand what is being said, it's just like, hey, yeah, that couldn't so please, in basic terms.
I'll do my best, absolutely. So basically what's happening, there is an abnormal electrical activity in the brain,
Right.
which can be caused by a lot of things.
Okay.
Okay, so this individual will be either collapsing and starting to jerk,
Okay.
or to convulse. We call it convulsing in medical terms. Okay, as I said, which can be caused by a lot of things. Now, commonly, somebody who's going to have a seizure, and I'm saying commonly because it doesn't always happen,
All right.
they have what we say is forewarning or aura.
Yeah.
So it's a sign that they will have a convulsion or a seizure. Okay. Now, if somebody is going to have a seizure,
Yes.
and as a family member, I imagine that you will know that they are going to have a seizure because they scream, which is one of the forewarning or the signs, or they can smell something that me and you are not smelling, or they can hear something that me and you are not hearing. So that is what we call forewarning. So when they get to that stage,
Yes.
you as the assistant or you as the family member, it's an opportunity to do something for that individual.
Okay.
And I will go ahead with that. So safety is of utmost important. Okay. If that person is sitting, okay, make that individual safe. Move other objects,
Okay.
okay, or move the patient from other objects so that when they are going to fall, they will fall safely. Okay. Or maybe get them off the chair to the ground, calmly, and because sometimes it's very difficult for them to cooperate because they are not there anymore. Okay. So safety is of utmost important. So I've mentioned moving them from objects or objects away from them. If they're wearing a tie, take the tie off, any restrictive clothing. If they were eating, remove food away from them. Anything that you think can be a hazard,
Okay.
move it away from them. That is very, 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 very critical in the beginning. Now, once they fall to the ground and they are convulsing, what you can do is, apart from making sure their surrounding is safe, is put them on the side, so that if there are any objects in the mouth or vomiters or anything, it doesn't go the wrong pipe as we were discussing choking. It will just ooze out. Okay.
Does it matter which side? Left, lateral position, right? Does it matter? Or just in any side?
Any safe side.
Okay.
Any safe side in that emergency situation. And just support them like that. Do not put anything inside their mouth.
Okay.
Okay. There is a common understanding out there that they are biting their tongue.
Yeah.
You must put a spoon in their mouth, or please do not put anything in their mouth.
Please, Mr. David, can you just emphasize that point and just maybe tell the viewers why City do not put anything? Because as you said, Vele, it's just put something quickly. That's what, usually is being said.
Right. And again, that's the understanding out there. But this is an opportunity of sharing the information of how we can treat our loved ones so that they don't hurt themselves further. So if you put something in the mouth, okay, let me rephrase and start by saying the reason why people are believing that putting something in the mouth will save life. They say they biting their tongue.
Yeah.
And it's very common that after the convulsion, you will see that the tongue is bitten. And it doesn't happen always, but it's very, very minimal. It don't get to a point where somebody cuts the whole tongue out. Okay. So that is very, very minimal. Putting something in the mouth will cause more damage because when they clench, it's not voluntary. They can break their teeth. They can actually cause serious damage.
Oh, okay. All right. And so, yes, you told us, Uguti, we remove objects, anything that may be hazardous, and then you may put them on the floor. Is it necessary to maybe put something, or something like that? Is that necessary?
If you have a pillow, because what we want to achieve here is they mustn't hurt themselves.
Yeah.
So if you have a pillow, it's not going to cause any harm. You can put, as long as they are lying on their side and you're supporting them, but do not restrain them.
Okay.
Yeah, as well, do not restrain.
Do not restrain them.
Yes.
And now, so when does one then decide, okay, now I need to call for help? Let's say I did all the things you mentioned, one is not winning. When do we say now we need to call for help?
Okay, and again, I will come up with a scenario.
Yes.
If somebody is known to be epileptic,
Yes.
because we've got a difference between just having an isolated seizure and somebody who's epileptic.
Yep.
So somebody who's epileptic, they are on medication. So the common cause might be we need to change the medication, we need to increase the strength. Normally, when they collapse and they start convulsing, they will come up and they become lethargic and they will go back to their normal stage. Okay, but something is not right. Even if they taking the medication, it shows that something is not right.
Yep.
They need help. Okay, so if you are one rescuer or one helper, okay, do what I said or what I recommended, and then after that you can phone for help.
Yes.
But now, here comes the very, very critical point. We've got a condition that we call status epilepticus. Okay, that is convulsing non-stop.
All right.
Or convulsing, stopping, and starting again. Convulsing, stop, that is a dire emergency. Okay, so if it's two of us, get somebody to go call for help, okay, while you're supporting and watching the patient. But if you are alone and you are facing that situation, leaving the patient on the side and calling for help, it's very, very important and it's very, very recommended as early as possible.
Okay. Thank you so much for that. I believe we will also touch on it a little later as we go through the demonstration. And last but not least, we want to talk about one having an acute asthma attack. Quickly, please, what is it? What does one do when they're actually having an acute asthma attack?
Okay. An asthma attack is basically lower airway problem.
All right.
Okay, so the person or the individual is struggling to get air right through the alveoli where gaseous exchange happen.
Okay.
Right, so the common signs and symptoms, okay, they will complain of breathing. Okay, they are breathing fast, rapidly, they are restless, and commonly again they are on medication, unless if it's an isolated, somebody was exposed to this and they had an attack. Okay, so there we've got bronchospasm, we've got mucus plugging in there, and we've got swelling there as well. Okay, if they are currently on medication, either the medication is not working, so it's an emergency. You need to call for help. Okay, they need to be taken in and they need to be reevaluated. What we can do now as family members or colleagues is let's not exert them. So as soon as they have an attack, where they are, if it's safe, let's not move them there, because we are now making them to exert themselves and they are struggling to breathe. So let's encourage them to sit down, calm down. If they have their medication, let's encourage them to take it, but not you putting them taking their own medication as well. Okay? And then calming them down, but we must call for help as well. And again, when you call for help, the controller that side will be giving you guidelines, telling you what to do while you're still waiting for professional help.
So Miss Nzima, you are the controller. You are the one that would be telling ukuthi yenza kanje, yenza kanje, yenza kanje.
Yes.
And then asithi umuntu mhlawumbe aka-understand like nimsiza njani, or maybe as you said, other people are just like panic, like like it's rough la ngaphandle. How do you get to like calm them down and actually get the information through to the person so that they do the right thing?
You reassure the caller, umtshela ukuthi makumama mama, ngicela wenze sona so kuzolunga, ngicela ubeke umoya phansi. Abanye bayalalela.
So kulaba ke Nkosi yami bangalalelanga bese nenza njani?
Isikhathi esiningi bayalalela.
Isikhathi esiningi bayalalela.
Yes.
And then does it happen maybe like kwenzeke into and then now you are overwhelmed, and because they are overwhelming you, and then awusazi ukuthi manje udile kanjani? What do you guys maybe do in such situations? There's a communication barrier. Awuzwa kahle ukuthi bathini. So like how do you ensure ukuthi like the information you are giving them is the right one based on into mhlambe bakutshela yona?
Absolutely, and it's very, very, very common.
Yes.
I think the first thing that needs to be cultivated in our own communities is cooperation. Shows like this ones can actually teach, encourage people to cooperate with our services, our control rooms, to say what they are saying might sound like they are not taking you serious or urgent, but they do. They are trained to handle the situation. So if we can enjoy cooperation from the side of the community or the caller, that can make life even easier, and the outcome for the patient will be even better.
Wow, I love it, Babugeli Amakaya. I hope you heard it. Remember, it's them and it's us. Sonke we are working towards a common goal. So kubalulekile ukuthi sisebenzisaneni. Sometimes you may think ukuthi they're not taking it seriously. Uyasho ke kanti Mr. David, no, that is not the case. Instead, they are calm because they have been trained to be calm. Them being calm does not mean that they do not take you seriously. So please, Babugeli Amakaya, let us cooperate and do what we are told to do. So now we've asked the patient to be calm, going back to the acute asthma attack. We're trying to get the patient to be calm. What else can we do?
Okay, so we've reassured the patient, encourage them to be calm, and encourage them to take their medication if the medication is still there and is not expired. That's basically what we can do from the side of the assistance or helper. And then call help, and then make it very, very clear of your situation here as well. Cooperation again will come into place. And situation differs from situation. Control room will guide you and suggest things that you can do in the meantime. But now, from our side, if you give us accurate and I mean accurate information from your side, we will be able to dispatch a relevant resource. Okay, so we are fully dependent on what you are telling us that side. And then the assistance that will be coming from our side, they will come with the proper medication, resources, and the patient will be in good hands.
Wow, I love that. Babugeli Amakaya, I hope you heard Nilalele, Nizwile. Now we're going to actually be going into the demonstrations. But before we actually get to those demonstrations, please, Mr. David, Impumake, just tell us quickly, briefly, what is Impumake? Where do you come from? How did you get here?
Thank you. Mpumake's full name is Mpumake's Medical Support. That's the full name.
Mpumake's Medical Support.
That's correct, yes. Yeah. Mpumake's was launched in 2017 August.
Right.
So we just celebrated the third year.
So you're the new kid on the block.
We are.
Hey, we love youngsters.
We are. But we've achieved a lot. We are very much proud.
Love that.
Absolutely. We've got a footprint in Limpopo and Mpumalanga currently.
All right.
But the intention is to roll out to other provinces as well. And I think it's possible.
Definitely,
yes.
It is possible. And so, how big are you? Like, you in Mpumalanga, you in Limpopo. Anywhere in Mpumalanga, Nelspruit, anywhere in Mpumalanga?
Different places, but our main footprint or focus now is projects.
Okay,
Okay.
Briefly, what kind of projects or other services that do you guys actually provide?
Okay. I'll approach it from this angle. The services that we run pre-hospital care.
Okay.
Pre-hospital care means motor vehicle accident, pedestrian vehicle accident, house calls, asthmatic, epilepsy, like we just mentioned. And then we run corporate models as well,
All right.
where we do medical standby at projects.
Okay.
There we're looking at injuries on duty, medical cases at the site, and then we transport to the relevant appropriate facility.
Yep.
Okay, and apart from that, we've got training. We've got a company which is a sister company to Mpuma Care Medical Support. It's Lab Medics. Is taking care of all the trainings. Okay.
So one can call, if like corporate, you need maybe training in so and so, you guys can actually do that?
Correct. 100%. 100%. That's what we are strong at currently. Okay. So that's Limpopo and that's Mpumalanga currently. That's where we are strong. We have services at projects, construction sites, mining. Yes.
And now I would like you to please tell us, what is the importance really of actually acquiring these trainings that you guys offer? What is the importance of that, and who should have those kind of trainings?
Okay. Our trainings in this industry are absolutely life-saving.
Yep.
Okay. So we offer training to schools, old age homes, minders, and even just helpers, okay, at homes.
Yes.
Corporate as well, we do first aid training, we do, yes, at corporate sites as well. It is, as I said, it's life-saving. So I cannot emphasize it more than that.
All right, and
Yeah.
it's something for everyone, yes? Would you
Absolutely.
say it's something for everyone?
Absolutely.
Akukhathalekile ukuthi unjani, ungakanani, but it's a skill that one should actually have.
It is. Some of the trainings, you will receive a certificate of competence.
Okay.
Some you receive a certificate of attendance.
All right.
They differ the courses or the programs.
Okay. We love that. Babugeli amakhaya sisisa khona kuyo i-holistic healthy living. Lapho sinifundisa kabanzi ngezempilo. Manje we actually going to go into the demonstration, so please singanyagazi so that we can see what they have to show us. And very important, siyaqala, please pay attention. Ubhekisise kahle ukuthi kwenziwani so that you will do it right. Siyabonga. Welcome back, Babugeli Amakaya. We are ready for you, and I hope that you are ready to learn. And we're going to be showing you the things we were talking about, particularly choking and also CPR. Sizongena nje phakathi endabeni, Mr. David, nangumuntu, they calling the controller, they are choking. What do you do?
Okay. What I want to share is the safety rule.
Okay.
Okay. If you happen to have an infant or a child who's choking,
Yes.
okay, you need to kneel down
All right.
or have a chair
Okay.
that you can work from, or work over a bed or a table. Okay, the reason for that is very simple, so that if the child happens to fall, they don't fall from a long distance or a, okay, then you end up with a head injury and a choking case. Okay, so you kneel down and we will demonstrate exactly how the technique is done.
Okay. Please take over.
Okay.
I just called. It is happening. I don't know what to do.
Okay.
Yes.
Just we will be doing or guiding you to do what we call back slaps.
Okay.
Okay. It's 5 of them, and then you rotate the child, and then you do chest thrust.
Okay.
Okay. We will demonstrate that briefly.
All right.
Okay.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
So you will be continuing to do this until the object is out or until help arrives. Okay. Or if you decide, because it's a small baby, if you decide to drive to the hospital, you can continue to do this as you're driving to the facility. Okay. If there are additional information or suggestions, the person on the other line will be able to guide you to say, continue to do that.
Okay.
And you will notice that when she's rotating the patient,
Yeah.
she looks inside.
Oh, she
If you-
looks inside.
yeah.
Okay.
If you can see something inside, you can scoop it out with the little finger. But if you don't see anything, don't put the finger blindly in there.
Alright.
Okay. So it's back slaps, times 5. You rotate, chest thrust, times 5. And then you just continue that while you now and then checking in the mouth if you can see the obstruction itself.
Okay, a quick recap, please. Can you show us once more?
Okay, let's do it one more time.
It will be 1, 2, 3, 4, 5, 10. 1, 2, 3, 4, 5.
Okay, thank you so much.
And again, being lower or next to the ground will help a lot. If ideally we're hoping that the child don't fall, but an accident can happen. So if the baby falls, at least it will be from this. Yes, yes.
All right.
Okay.
Now, what is the next thing that you will be showing us?
Briefly, we wanted to demonstrate CPR on an infant of this size.
All right.
Okay.
What is CPR? Quickly.
Okay. CPR, it's an abbreviation.
Yes.
It's cardiopulmonary resuscitation. I know maybe for some of our viewers it sounds like too much.
Yes.
Okay. But basically we are trying to breathe
Yes.
for the patient who cannot breathe, and we pump in the chest. We're trying to pump blood in the heart, to circulate the blood. So we will briefly demonstrate the CPR.
Okay.
BVM.
Okay. So that is our mannequin, and
Yeah.
I've got a device in my hand which we call BVM. Okay, back valve mask. And again, maybe it's too much for some of our viewers. Okay, this is to push air in the lungs.
Okay.
Okay, there is a specific technique that we use to ventilate an infant. And quickly, if you don't have this, I imagine not many people have this at home. Okay, there is a, should I say, controversial maneuver of mouth to mouth, especially currently with the coronavirus around. Okay, some people are saying they will do mouth to mouth on somebody they know. Fair enough, but we don't go out and teach people to do mouth to mouth.
Okay.
No,
All right.
we say no. But if you feel this is my loved one, this is my child, I don't mind to do it, the decision is yours. Okay. But us pre-hospitally, this is what we use, this device. Okay. If you don't want to ventilate using mouth to mouth as we just discussed, okay, you can continue with compressions without ventilating until you get to the hospital or until help comes to you. That is an option as well. Okay, so we're going to demonstrate using a back valve mask.
Okay.
Okay, okay, we may go ahead.
It's a 50.
Okay,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
okay,
One,
and
two,
and basically, as you're doing that,
3,
4, 5,
when you
6,
ventilate,
7,
if you ventilate,
8,
you just
9,
want to see
10,
the chest
11,
rise.
12,
Okay, that's a sign
13,
that there is
14,
oxygen
15.
going in. Okay, but if you don't have anything that you can ventilate with, you can just continue with the CPR. Okay, so this is a technique that can be done by 2 people or can be done by 1 person. Okay, if you want to know further or more about this, you can simply enroll and then you will get professional training.
Alright. Siyabonga kakhulu. And now, what is the next one that we will be moving on to?
Okay, we've just dealt with infant CPR
Yes.
and choking. We will deal with adult CPR.
Okay.
Okay.
question. Adult choking. Will you show us what to do in the case of adult choking?
Yes,
Okay.
yes, which is very much different from what we do.
And we have our adult mannequin, and they're going to be showing us if an adult chokes, how do you do it? Adult CPR, how do we do it? Siyabonga babukeli ukuthi you are actually learning. This is all that we want. So please take us through it.
Okay, and again, this is CPR,
Yes.
cardiopulmonary resuscitation, pumping the heart and getting oxygen circulated.
Okay.
Okay, this technique can be done by one person, or if you're lucky, there is assistance. It can be two of you.
Alright.
Okay, you just want to blow air to see the chest rise, and then you do the compressions.
Okay.
Okay, and again, just like an infant, if you don't have a device to ventilate, you can continue to do compressions until help comes.
Okay.
Okay, okay. So let's demonstrate the compressions. Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10,
they will be
11,
continuing
12,
like that.
13,
In
14,
and adult
15,
is
16,
30,
17, 18,
and
9,
then two
20, 21,
ventilations.
22, 23, 24,
see
25,
she's putting
26,
her
27,
hands in a
28,
very
29,
specific way.
30.
Does that matter? And she puts it in a very specific place.
One,
Can you just quickly tell us
two.
about that?
Okay.
1,
We are
2,
basically
3,
in basic
4,
terms as
5,
well
6,
to target
7,
where
8,
the heart
9,
is. So
10,
where she has
11,
put her
12,
hands
13,
is basically
14,
where the heart
6,
is.
17,
Trying to
18,
compress the heart
19,
to
20,
recirculate
21,
the
22,
blood.
23, 24, 25,
Okay?
26,
And
27,
again, counting is very
29,
much
30.
important. There's somebody who's helping you
One,
will know exactly
two.
when to come.
Okay.
I think the patient is waking up now. That's good compression.
Okay.
Okay, without undressing it, just bring it. Thank you. Okay, now we will briefly demonstrate how to manage a choking adult.
Yes.
Okay, few rules there. Okay, if you get to somebody who's choking, explain yourself. Tell them or tell him or her what you are going to do, so that you can get the permission or consent.
Yes.
Okay, you will be standing behind the individual, okay, and putting your hand just below the navel, okay, on the navel.
Yintoni na vele?
Okay. A navel, a navel, and apologies again maybe for using language that might not be understood out there by everybody. The umbilicus, okay, so you put your hand there, you will be going in and up, so you like scooping,
Okay.
okay, but that's forceful, okay, that's why you need to get permission and cooperation from the individual. You stand behind them, you get in their cooperation and understanding, and then you put your hand there, and then you push in and up. Okay. Now you can have a patient who is pregnant. Okay. It doesn't mean people who get pregnant they can't choke. No, they are not exempted. Now your technique will, or your location or your landmark will change slightly.
Okay.
So you will go above the belly. Okay. But you're still doing in and up. Okay. You can combine that with asking the patient to cough as well. So you're asking the patient to cough and you're doing that, that can work. Or before you even try the maneuver, you can encourage the patient to cough. Okay. That as well, you can do it on yourself, because you can also choke while you're alone there. So you can do it. If you're not choking, it sounds like, but if you're choking and your eyes are out, you're worried, you will do it very, very effective. So you're pushing in and up.
So you're pushing
And
in
you-
and up.
And you can combine that with coughing as well. That can help. If you don't get luck
Yes.
and the patient get unconscious, then you start CPR now.
Then you start the CPR.
CPR here, and hopefully the object will come out or help will be there by then.
Siyabonga kakhulu. I hope nifundile. Just one quick question. Sibone umuntu they choking and then you just hit their backside. Is there a place for that?
Very much, very much. You explain again, it's very, very important to explain to somebody, because if I come to her and just that can be understood differently. Okay, so you explain what you are going to do and what you want to achieve. Okay, but in that case, if you're going to do that maneuver on an adult, it works if you ask them to lean forward. You want to get gravity there as well, so that when you slap, you know, gravity will help you to get the object out. So that is another technique that you can use.
Crystal clear. Siyabonga babukeli emakhaya. I hope ukuthi you learned a thing or two, because trust me, I learned a lot. Mara ke ningakhohlwa, when you need help, you definitely must call for help. Kukhona abantu abafundile and they actually know this thing. Which brings me to my next and last question. If now people want to get a hold of you as Ngobese, where does one go? What can they do to get a hold of you? And also, if they're outside of the provinces that you mentioned, but they would like these trainings that you offer, can that be done?
Absolutely. If you are outside the mentioned provinces,
Yes.
and you need training,
Yes.
that can be done.
Okay.
Or if you need some corporate products, that can be done as well.
Right.
But if you call and you are outside our area of responsibility, we will gladly give you the numbers to dial, you know, so that you can get a service that's very much closer to you, whether being a provincial, whether being another private service.
All right.
But if you are in our area, you may call, Usbahaisu will give us the number for Ngobese.
Okay.
Okay. You'll be calling the number 063
063
640
640
3005.
3005. Thank you so much. And now I just have to ask, umuntu mhlawumbe uyazibuza ukuthi, okay, angina medical aid, I need to go to a public hospital. Would you guys actually help me, or do I need to have medical aid, or how do we go about with that?
Okay. The rule out there is, and that's the general common rule is, we ask about medical aids later. If somebody is in a serious emergency, we want to intervene, and then we will talk about that later. Okay. We will be taking you to the nearest appropriate facility. Okay. Appropriate is the key. So, because some of our viewers don't understand, they want to go to this hospital, and we're taking them to this hospital, is because this hospital is not appropriate for this situation. They won't be able to continue what we're doing, or they won't be able to intervene accordingly. So we're not making life difficult for you and saying, no, we like this one, we don't like this one. So understanding from the viewer side there as well can really make life easier for the patient and for us.
Wow, thank you so much. And please, amagama wokuvalelisa to the viewers.
Thank you very much for the time, viewers, and I want to take this opportunity to say to our colleagues, fellow EMS providers, remain focused, remain positive. You are doing an utmost great, important work out there. Okay, don't get discouraged, don't get derailed, stay safe.
Stay safe, and from us on Holistic Healthy Living, we would like to say thank you. Thank you so much to Ngobese for actually honoring us and coming to teach you and really be of great value. Githi thina sonke siyabonga kakhulu ukuthi benihlanganyele kanye nathi ke ayikaqabananga. From our side on Holistic Healthy Living City, please do continue to take the necessary precautions, because indeed we are still going through a pandemic. Do not forget to sanitize, do not forget to put on your mask, social distancing, stay safe. Next time, khona kule ndawo at the very same time, sizobe sinifundisa more about your health. Thank you.